Hello, welcome, welcome. You
Thank
can
you.
sit anywhere you're comfortable.
Okay. I think here is okay. Thank you.
Okay. Hope you're comfortable.
Yes, I am.
Yeah, we have some water. When you're thirsty, you can drink.
Thank you.
Okay. Um, Hope you didn't find it difficult to locate this clinic.
A little bit, but it's fine. At least I'm here.
Okay, you're welcome. And it wasn't hard to find a parking spot.
No, not really. No, no. I think you guys have a nice parking space. So nice.
That's all right. Thank you. Okay, I've been looking forward to this meeting because I've been looking forward to meeting you today so that we'll be able to work together and take care of the problem you spoke to me about on the phone. Okay, my name is Dr. Priscilla. Please, may I know your name?
I am Rita.
That is all right. Welcome, Rita.
Thank you.
Okay, my name is Dr. Priscilla Mweke. I have PhD in counseling psychology. I specialize in depressive and anxiety disorder. I've been working in Gillen American University for 11 years now, and I've been operating this clinic for 7 years now. Okay, I have to tell you that about the issue of confidentiality. Yes, anything we say in this circle will be private. We are bound by law not to show it to anyone. So you have to feel free to say anything you want here. Just bear in mind that it will be private. Though we have some limits to confidentiality, what it means is that some situations we are bound to disclose what we've discussed here. Just few situations, like when there's a court issue, the government can order for the information and we are bound to surrender it to them. Or if we denote from our discussion that you have issues with suicide, or you're going to harm yourself or harm someone else, let's say an elderly or a child, a defenseless person, we are bound to disclose the information so that they'll take care of the issue. But you have to know that all these things, these situations, they are all to help you. So there's nothing like to harm you in that situation. Okay? Yeah. We have to talk about what we are going to do today. Here is just interview, the first step of therapy. So I'm going to ask so many questions and I'm going to jot some things down. And the reason why we have to jot things down is so that I'll be able to have records, be able to have accurate records, to be able to diagnose the problems you're going to state to us today. Hope I'm free to jot things down.
Yes.
Okay. Okay, just to tell you about it.
Okay.
Okay. Now, I want to know your expectations. What are your expectations before you came here? What do you hope to achieve from this therapy?
Honestly, my expectation is I wish, because I have a lot of anxieties, and most of the times I feel like I am hopeless about the whole situations. So I feel like you can help me to cure these whole things. That is why I am here. I feel like I need solutions. I need cure to this problem to end.
Interesting. Okay, your expectations are not a bad one. It's accurate for a situation like this. But we have to let you know that sometimes clients have unrealistic expectations, and we have to tell you that these are expectations about we helping you cure. We cannot cure any diseases or problems. We are here to help you manage it, and we have to work with you. We are working together in collaboration, and the bulk of the work have to come from you. You have to accept what we are going to do, say, and accept the processes, the procedures, to be able to apply them in your life, to make changes. So our job is just to guide you, point out the areas that you have to do something about, and you will do the bulk of the work. Hope you understand what I'm saying.
Okay.
Okay. So just know that We cannot help you cure. We can only help you manage your problems and help you start enjoying your life and hopefully reduce the symptoms that you're going to tell us. Okay, that being said, hope you are comfortable the way you're just sitting. You can drink some water if you want. Okay?
Thank
Okay.
you.
Just feel comfortable, relax, and feel free. Okay. I would like to know what concerns brought you to our clinic today. Please, how may we help you?
Honestly, I'll be honest with you. The whole thing is much on me right now. I am so depressed about the whole situation. I can't eat. I the only thing I like to do is just to sleep.
That's a terrible situation.
You know, I feel tired always. I feel tired. Can you believe before I used to go out, but now I hardly go out. I can't even go out. I always feel I can't even tolerate people, and that is one of the most important aspect of it. I feel attacked. Anything people say, I feel attacked, and I'm always sad with people. Everybody around me complains about this whole situation, and it's kind of eating me up. So
That's
many
so hard.
things.
It must be so hard for you.
So I am honestly I'm depressed at this point. I feel like I'm worthless. I feel like I'm hopeless. I feel hopeless.
Wow. That's a terrible situation.
Honestly, I'm sad about my life. I don't
feel
even
your
know
pain.
what to do at this point of my life. So it's one of the reasons I decided maybe I should come and see a therapist to help me solve this whole situation.
You know, you're in the right place. You're in the right place. We're on your side, okay? So it's all right. How often do you feel this way?
Every time, every day, most of my day is ruined because I'm always sad. I can't do anything the way I used to do before. I'm not a happy person.
That's a bad situation to be in. I understand.
I don't know what to do. I can't even figure out what to do with my life anymore. Most of the times, all I want to do is to lock myself inside and sleep. That's all I want. I can't even eat normally. I can't even do anything straight out. I go to work all, oh my goodness, Lord. Everybody complains I'm a bitter person
I understand you.
because this, oh my God, this situation is terrible.
That's a sad situation. Okay. When did you notice the symptoms?
Exactly 3 weeks today.
Okay.
Yes.
3 weeks. Did anything prompt it? What happened that made it start, or it just started on its own?
Actually, this started on its own. I had a breakup with my boyfriend.
Oh, that's
So
sad.
since then, everything changed. Everything about my life crumbled.
Okay, I understand you. Okay. The sadness. Do you used to feel sad when you were in a relationship or when it ended that it started? When did it start exactly?
It started when we separated.
Mm.
It's since then I have been a sad person. So that's just it.
It's all right. What about your relationship with your colleagues? Can you tell me about it, please?
Yes, like I said to you, I can't even everybody around me complains that I'm a sad person because every little thing they say I attack them. I don't fancy anything again. I lack patience with people.
Okay, let me see if I understand what you're saying clearly. You're saying since you broke up with your boyfriend
Yes,
for three weeks ago, that you've been feeling sad,
yes,
you've been finding it hard to eat,
yes,
and you've been irritable,
yes,
always angry.
with everybody around me.
Okay, I understand now. What about how do you sleep? How is your sleeping habit?
That is it. All I want to do is to lock myself indoors and sleep. I
Mm.
don't want to do any other thing. I don't want to socialize with people anymore.
Okay. Okay. What are the things you love to do in the past? How about them? Do you still do them?
No, I can't. It takes you to be happy to do things you like. I
Mm.
can't even go out. I like to party. Years before, I like to party. I go out with my boyfriend. I go out, we meet people. But since 3 weeks now, it has been hell with me. I don't even go out. I just want to be left alone.
Mm. Okay. I understand you. Apart from your boyfriend, do you have friends?
I do, but I have been isolating myself from everybody.
Mm.
I just want to be alone
Okay.
because I'm not a happy person.
Okay. I understand what you're saying. It's a very sad situation to be in. But I have to ask more questions. When you encounter difficulties, may I know your coping mechanisms? Like, what do you do to help yourself elevate yourself from the difficult situations?
Nothing really. I can't say there's nothing. I don't do anything.
Okay. How does this situation make you feel? I want to know how it makes you feel. This your whole.
It makes me feel worthless. I don't see my words again because I don't socialize with people. I don't do anything I
Mm,
used to do before. So I feel, honestly, this whole situation makes me feel hopeless
I
about
understand.
myself.
That's so sad to know.
Yes, it is. It is terrible. If you understanding me, I am in a terrible situation right now.
Okay. Well, it's okay. I want to know, have you ever thought of suicide, ending your life, something of that sort?
Yes, I've had that thought numerous times, but I have
Hmm.
not acted on it. But if this whole situation can make one to think of so many things.
Okay, I understand you. Well, it's good you've not acted on it. It's very, very good. That is nice. I understand your situation. I understand your pain. I would like to know if you've seen therapists in the past. Please, have you?
Yes, I have with my boyfriend actually.
Okay. For what
Yes.
reasons, please?
We met a therapist for our relationship.
Mm.
Yes.
Okay. I would like to know something else. When you used to feel sadness, have the symptoms, um, how do you feel physically?
Actually, I used to have headache. I'll be
Okay.
having headache, serious headache.
Okay.
Yes, and most of the times at night also, my heart beat faster. And this whole thing started
Mm.
within this time I've been we broke up.
Okay. That's 3 weeks ago.
Yes, since
As you
3 weeks
said.
ago it started, and you know this headache, my heart.
Mm.
Oh my God! Let me go.
Mm. That's a bad situation. It's all right. It's all right. Okay, you said, may I understand you better? When you're feeling sad, you are thinking about your
Yes, when I'm
relationship.
thinking
You are
about
broke up. Okay.
yes, the whole thing, the whole situations, it makes me have my head start pounding,
Okay. And your
and
heart.
and yes, it also affects my heart. It makes it to beat too much more than
Okay.
how it used to beat.
Okay. I understand you. Okay. That's the whole physical symptoms you used to have when you're
Yes.
feeling that. Okay. No problem. I have to commend you because I know so many people that will be having issues. They won't see any need to see a psychologist or therapist to help them with their situation. So I have to commend you for coming in at all because coming in means it's one step to helping with your situation. Yeah, we've had so many people coming here with the same symptoms, and I know so many of them they gained a lot from our therapy session. So we'll sure help you to guide you with this situation that you are in. It's all we have to come back to the expectations, just like you said earlier, that you want to be healed.
Yes.
Yeah. And I have to mention it again that we cannot help you cure. We cannot cure any problems or illness. We can only help you, guide you on ways in which you can help alleviate the symptoms that you're having so that you can start enjoying your life. In situations that you cannot help yourself, we give you rules and guidelines on how to help in affecting change in your life. Okay, that being said, are you on medication for any reason? Are you on medication?
No.
Okay, that's good. Okay, have to tell you everything you said here, so I'll be sure I understood you better.
Yes, and
Okay.
I have lost weight.
Yes, I can see
I've
that.
lost weight
It's a bad situation to be in.
because I lost my appetite. I don't eat anymore.
Okay. From what I heard you said, let me be sure I understood well. You said since you broke up with your boyfriend 3 weeks ago,
Yes.
you've been feeling sad, you've lost your appetite, you've lost weight, you are always angry, you've had suicidal thoughts, but you've not acted on it before. You feel tired all the time, that your heart pounds a lot when you're thinking so much about your relationship, and you have headache all the time. And you said what you loved to do in the past, you don't enjoy them anymore, and you feel hopeless and worthless. You feel your life doesn't have meaning anymore, and you don't relate well with your colleagues anymore. So what I said there in order, according to what you said.
Yes, exactly. That's how I feel about the whole situation.
Okay. From these whole problems, these symptoms, they are likely to be major depressive disorder because they fall in line with what is expected as major depressive disorder. Though the one you said about your heart pounding, that is not part of major, it's anxiety. So we can say that you have major depressive disorder and one symptom in anxiety disorder. Okay, we've had just like I told you earlier, we've had so many clients coming concerning this, and we help them 100% to help take care of situations in their lives and skills in order to cope when they're having this depressive disorder that makes them come out of it and start enjoying their life. All right, I have to tell you that this whole situation will be fine. Here is the first step. You get better, definitely. You start feeling better. And I understand how you feel. This is not the first time you've seen it before. So be rest assured, you're not the first person I've ever had this symptoms before in the past. Okay? So, that being said, we have to talk about our next session, because by you having these symptoms, it means you need immediate help on skills in order to be able to cope when you are feeling this way. Because when you are feeling sad, you have headache, you are angry all the time, you are sleeping most of the time, you are not eating, it means you need some skills to be able to, practical skills to affect change, to help you feel better whenever you are down in that situation. So our next session will be able to teach you practical skills that can help you. Yes, and that's what we are going to discuss in our next session. Okay. We would like to know, I would like to know when next you'll be free for our next session.
Do you give people by yourself or I have to choose
No,
on
you
myself?
have to choose by yourself, yes, so that you choose when you be free and you come and be relaxed without thinking of something to go and do. So you have to choose, and we have to fall into your own plan. Excuse me.
Okay. In 3 days' time, because I
Okay.
need this whole, I need your help.
Okay. Okay, that is nice. Okay. How do you see this session? How are we doing? Hope we did all right. What you expected, you feel better than when you came. How do you feel now?
Yes, I feel a little bit better, at least seeing somebody to talk to about my fears, my anxiety, you understand?
Yes.
Because being you are in the field, this is your field, you already know how it is.
Yes.
So you don't go out. I'm stuck in my room. I only think about this whole thing. You know, heartbreak is not,
Yes.
especially when it's somebody you loved with your heart.
Yes, I understand.
So, but at least saying out my problems,
Yes,
it helped me a
yes.
little bit. I believe maybe with time I will be fine. If
Okay.
you, with your help.
Yes, that is true. That is true. And given the symptoms a name, now we know what we are dealing with. Then you are going to know when you start feeling that way that help is on the way. Okay, that is all right. We'll see, just like you said, in 3 days' time. What time can you be free? What time?
Yes, I can make it 11 a.m.
That is all right. Okay. Okay. If you have any need to make any changes about the schedule, you can call my secretary to reschedule.
Okay.
Okay. And if you need a special parking spot on that day, you can tell the secretary about that too. Okay. That is nice.
Okay.
Thank you for coming in. We are looking forward to seeing you in 3 days' time.
Thank you very much. I appreciate your help.
You're welcome.
Thank you.
Bye bye.